The rate of emigration of health workers from Nigeria has continued to worry health managers and the government. Thousands of health workers have reportedly left the country in the last few months in search of greener pastures abroad. With doctors and nurses living in droves, experts are warning that there is a silent crisis rising in the health sector in Nigeria with far-reaching consequences for the nation. Well, Dr. Usman Abdulrahman, consultant physician and public health expert, is here to look at this situation and its implications for Nigeria's health sector. Very warm welcome to Newsnight.
Thank you.
How bad is the situation? Bleak?
Very bad. Very bad. Some CMDs has even reported that they receive resignation letters from health workers on daily basis now. Our hospitals are almost empty now because the health workers, not just doctors now, nurses, they are moving out of the country in numbers.
Radiographers and the rest.
Yes, yes.
Pharmacists?
Pharmacists, less of pharmacists, but doctors, nurses, radiographers, they are moving out of the country on daily basis. And we need to arrest the situation. We are talking of universal health coverage. How do we get there if our hospitals are empty? Because human resources is key. If no health workers for patients to go and see, so how do you achieve your universal health coverage? How do people access the health services?
Well, I think the present Minister of State for Health had come up, on a program to say that the health ministry is doubling the numbers of nurses being trained and the rest. Maybe at the end of each year, we probably will be seeing close to about 500,000 or so, an accelerated health training program to bridge the gap of, the emigrants that is given the health sector a lot of concern.
Yes, it's one way to solve the issues. But then, if somebody starts school today, is the person going to finish this one in 1 year time? No. So we are talking of what to do now before that process can arrest the situation. I and you know that for medical students, you need to spend 6 years. For nursing, at least minimum of 3 years. And other health workers, they need to spend like 4 to 5 years before you can graduate. And you have to go for internship, NYC, before you can be employed fully as a full staff. So how long are we going to wait before then? That is the question. So we need to look into what we can do now to arrest the situation before then. So that is not an immediate solution. If you are talking of a long-term solution, fine. But short-term solution, no.
So what is, you're a public health expert too, apart from being, a consultant physician.
Yes.
So what would be the immediate solution to arresting this situation?
We need to look at why people are moving.
Isn't it obvious why they are moving?
So if it's obvious, then we need to do something to stop it. Number one is we know that the economy is bad, the welfare. So we need to look at the welfare of the health workers. What are their demands? Look into their demands and see what you can do. 80% are actually moving because of the greener pasture. But some few people are also moving because they don't have enough equipment to practice.
But Nigerian doctors or health workers are well sought after and the rest, even where they emigrate to. And recent report now from the United Kingdom is that Nigeria is becoming, a health destination for people coming to see consultants like you, whether it has to do with dental issues, surgeries, and the rest, is that not health tourism to Nigeria too? So what is anybody going out there to do?
The point is, people are going there to seek for health. But we are not even concerned about the people going there. We are concerned about the health workers going there. Because we are concerned about our own hospital here. Who sees the people, the patient that goes to the hospital? That is our point here. People can decide to go for medical tourism. The unfortunate thing is that
no. I mean, from the United Kingdom and some other parts.
Yes.
You know, the waiting time, for example, to see a consultant. I'm not talking of a general practitioner
Yes.
now. Some 2 years, you're still waiting. Maybe you want to fill a tooth or extract it and the rest.
Yes.
And Nigeria is gradually becoming a mecca for health tourists now. So that's inflow of forex, right? So there must be something really good about the Nigerian health system.
yes,
Despite the immigration.
We cannot really say Nigerian health system is totally poor. Of course, I can tell you that most of them that even go abroad, they still go there as the Nigerians. Somebody was telling us stories recently that he went to abroad and they told him that, well, if you want to see a doctor, by Tuesday it's a Mecca you see. By Thursday is it's Okoro you are going to see. And the man was like, I was a bit frustrated. How can I travel all the way? I did not come from Nigeria to see a Mecca here. And they said, well, on Tuesday, that's the person that is there. On Thursday, this is another person that is there. So what I'm trying to say is that Nigeria is good. We have good people. We are intelligent. We know what we are doing. But the problem is the welfare. So we need to look at that. The waiting time we are talking about, yes. So that is why they are coming here. Because at least when you come here, instead of waiting for 2 years, you are sure that you wait for probably maybe a month or less than a month. Yes. So that is why maybe some of them are coming here. But I don't see that very often as a practice for now.
But, okay, very quickly now. When you look at the statistical data of these medical immigration or health workers immigration to other climes and the rest, is it more in the private hospitals or health facilities or in the government facilities, for example?
My brother is everywhere, but however, it's more in the government and other health institutions. I can tell you a story of about 2 days ago. I was discussing with a HMO manager, and the man told me that out of the people, about 3 or 4 clinicians that are supposed to ratify what the hospitals bring as claim, only 1 person is remaining. Others have traveled. Others have gone out. So it's not just about private. It's any health institution is suffering it. So that is why it needs urgent.
An emergency, to declare an emergency in the health sector. I'm sure Professor Ali Pate, the Minister of Health, who is internationally known, is listening.
There's need for a stakeholder meeting.
Well, even the president, talked about it in one of his, programs on health and the rest, and he said the health of the people is a priority for his government now. Well, thank you very much. Dr. Usman Abdulrahman, consultant physician and public health expert. Thank you for coming on News Night.